On 8th July 2021, a 55-year-old man died and another was grievously injured after being hit by a cab in central Delhi's Daryaganj area. Their names were Kallu and Kanji, as reported in the Times of India. In 2021, over a lakh and a half people were killed and 3.85 lakh people injured, and over 4.1 lakh road crashes happened in India. Those are staggeringly huge numbers. But these are not just unusual figures. For decades, we've seen a similar number of crashes, injuries, and fatalities in India. Welcome to Milestones, the Save Life podcast with me, Karthik Dr. This is a show where we discuss various aspects of road safety with the aim of ultimately working towards safer roads and a safer India. I'm your host, Karthik Dr. And today we're joined on the show by Dr. Amit Gupta, one of India's most renowned trauma surgeons. Dr. Gupta is the chairman of the Asian Collaboration for Trauma, a federation of the trauma societies of 21 Asian countries. He's also a professor of trauma surgery and critical care at JPN Apex Trauma Center at AIIMS, New Delhi. Dr. Gupta, welcome to the show.
Thank you, Karthik. Thank you so much for having me in Milestones. And I think it's a great move forward to spread the road safety awareness as well as the treatment part to our masses. Thank you so much.
Absolutely. Absolutely. Dr. Gupta, you must see many patients of road crashes being wheeled into the emergency room on a daily basis. What is it like seeing and treating these cases?
So it's a bag of mixed feelings. These are young chaps coming into a trauma center, having road crashes and literally, sort of very, very critical stage, which is needless, which is absolutely needless because road injuries or road traffic injuries are 100% preventable. And number two, the more bizarre fact is that most of them are like in the age group of 18 to 40. They are the future of the society, and they getting injured, if they are saved, getting permanent disabilities like amputations, like head injuries, like spinal cord injuries. It's a bit despairing, but at the same time, because if the treatment is done well, they are the ones who recover the best because they are young. They don't have any comorbidities. They don't have any other sort of medical illnesses. So it's a mixed bag of feelings, but I personally would feel that more satisfied if I am out of business being a trauma surgeon, to be very frank, than being in this profession. It is unfortunate indeed.
You mentioned some of these cases, which sounded to me as a layperson very severe. But what are the usual types of injuries that you witness, in your experience? Are they all belong to a certain type, or are they quite diverse?
So, if we broadly classify as mechanisms of injuries or modes of injuries, which are coming into our trauma center, well, obviously, the road traffic injuries are the chunk, which is about 50 to 55% of all trauma victims which are coming into the hospital are road traffic injury patients. But not all patients are road traffic injuries. So there are a fair bit of accidental injuries like falls, like industrial accidents, agricultural accidents, interpersonal violence, and other forms of injuries. And within the road traffic injuries themselves, we see more of these so-called vulnerable road users. These are the people on the bicycles, on motorized two-wheelers. They're pedestrians, generally exposed to the elements. So there are many factors, responsible for these injuries. But primarily, the vulnerable road users are ones who get the most severe sort of injuries.
When you say severe injuries, can you give us a sense of how severe it is? What are the kind of injuries we are talking about?
Yeah. So internationally and so in India, majority of the injuries which take lives or limbs are categorized as severe injuries. And if I give you a brief gross statistic that majority of the people who die in a road crash have head injuries, right? So head trauma is one of the major causes of deaths. But at the same time, there are other injuries which cause a lot of bleeding. So we have chest injuries, we have abdominal injuries, and all the organs in the abdomen are really rich in blood supply. They bleed a lot, are long bones. So principally, I would say head injuries, followed by bleeding, followed by other injuries like spinal cord injuries and limb crushes, or extremity injuries, as we call them, to the hands and to the legs. These are the major injuries.
Dr. Gupta, you work in probably one of the busiest hubs, right, of trauma in this part of the world, at AIIMS. Recently speaking, are you seeing an increase or a decrease in the number of cases of road crashes coming to you?
It's been increasing. I mean, we were thinking that it will come down because of some strategies which you have taken in the past decade or so. But it's not even plateauing. And there's some mismatch between what we're doing and what we are getting. So there is a steady increase in the rates of road traffic injuries and the seriously injured patients.
Are you also seeing any specific categories which are becoming a majority of these patients, like people belonging to a certain age or economic strata or road user type?
Yeah, Karthik. So it's directly related to what I just mentioned previously, that the vulnerable road users are the ones who are exposed to the elements on the roads. And they are generally from those who are on the roads are generally the younger generation, but at the same time, those who cannot afford probably safe vehicles like a four-wheeler or a four-wheeler which has got all the amenities like an airbag, like ABS systems and things like that. So definitely from the lower middle income strata are majority of these patients who are coming in.
Road traffic injuries are estimated to be the 8th leading cause of death across all age groups globally. People in need of trauma care after a road crash are most likely to survive if they receive definitive care within the first hour after the crash. Essential pre-hospital care includes prompt communication, treatment, and transport of injured people to formal healthcare facilities. Are we as a country set up for all this? I'm sure we all know what the answer is to that. Doctor, whenever we speak to experts in this subject, we always hear the term golden hour, right? Can you tell us, for someone who's uninitiated, what is the golden hour and what's its significance when it comes to treatment and even saving the victim's life?
So basically, this term golden hours came out of the US, and it's still not scientifically proven, but it just stresses the fact that as a disease, trauma or injury is a time-sensitive disease. And every minute which passes from when you have this incident or accident on the road till probably the first line treatment is initiated, maybe in a smaller hospital, maybe just to stabilize you, is very, very important. So basically, golden hour means the first hour after the incident has happened or after the crash has happened on the road, till the time somebody receives some sort of a resuscitation. And that's very, very critical, very important.
And if I may ask, we live in a society where it's almost impossible to get to a hospital, on time, especially, the urban societies that we live in. While I feel like I know I won't enjoy the answer, what percentage of the patients, who come to you reach you within this golden hour?
Yes, you're right. You will not like the answer, but it is true that only about, I think I would say 25 to 30% of these patients in urban areas where the ambulance systems are slightly better. Within the city, if the incident happens, then maybe about 35 to 40%, but 60% patients are not brought to a hospital within that time frame.
Doctor, right after road crash, there are multiple things required to set a chain of survival into motion, right? I know we spoke about the time required to get them, but there are a lot of stakeholders involved, isn't it? Could you tell us a little bit about how many departments, activities, organizations even are required to be synergized to attempt to save the life of a victim?
Well, Karthik, actually, if we talk about trauma, we call the system of management of a trauma victim as a trauma system or an inclusive trauma system. So basically, a trauma system means a person gets injured on the road, somebody accesses the phone number, calls the police or calls the ambulance services. Till that time, he's taken care of on the roadside somehow or the other. And then after that, the ambulance arrives, the paramedics take care, they bring this patient to the nearest and appropriate hospital. Now, it's very, very important to have that in mind, that it should be not only the nearest but also the appropriate. For example, an unconscious patient is brought to a hospital which does not have a neurosurgical department, which does not have a CT scan. Then you are wasting time, and each minute is important, as I said. So, nearest appropriate hospital, and thereafter, something is done in the emergency room. That means the ED doctors or the emergency department doctors take care of him. After they stabilize, he might require a surgery within, say, minutes or the first few hours. Then that is ready within the hospital. So a trauma system is a complex system in which multiple stakeholders take care of the same very victim. The same guy goes through all these timelines as well as all these departments.
And what, in your opinion, in fact, just extending, your answer, if you have to take a call on how much our emergency care systems have improved, to keep up pace with it, what would you say, Doctor?
Yeah, I would not say that nothing has been happening over the past 2 decades or a decade. There are things happening, but we all have to understand that India is a huge country. We are a 1.43 billion country, and we've got states, we've got union territories. So what gaps are there? So there are 2 phases: pre-crash, post-crash. Right? I come into the being after the crash has happened, and the victim has to be sort of fetched and ferried from the accident site on the highways till the nearest hospital. So the gaps are that although the NHAI and the expressway concessionaires are mandated to keep an ambulance every 50 kilometers on both sides of the roads, so that the ambulance can go there within, say, a span of 10 minutes or so, pick up the chap. But the problem is whether these ambulance services are getting audited or not properly at the end of the year or at the end of a month. How many victims were there? What were the kind of injuries? Where were they transported to? So these are smaller aspects which are equally important, something like auditing of the pre-hospital care. Then again, the pre-hospital care, let's assume that the pre-hospital care is excellent, like number 1. Now, these victims who either died on the site or died on the way to the hospital are now being brought alive to the hospital. Again, after acute care, they are brought to a bigger level hospital. Is the bigger level hospital, who's already functioning full stream, ready to take these patients? Right. So I think there are gaps at each and every level. But to talk more, I would say in a positive manner, that there have been things which are moving. The government of India has decided that there would be certain hospitals designated as trauma centers all over the country. Things have been moving, guidelines have been prepared. The best part is in the past decade or 2, at least the awareness is there amongst the healthcare fraternity also, which was not there about 20 years back.
In the case of a road crash, bystanders will usually try to help the injured or at least call for help. That is the assumption. In India, however, it's different. In a country with some of the world's most dangerous roads, victims are all too often left to fend for themselves. The foremost reason as to why people do not help victims is fear of the police. It was found that oftentimes, if you assist someone, the police will assume you're helping that person out of guilt, that you were the one that caused the crash in the first place. Apart from the fear of being falsely implicated, people also worry about becoming trapped as a witness in a court case, legal proceedings that can be notoriously protracted in India. And if they helped the victim get to the hospital, they feared coming under pressure to stump up fees for medical treatment. How do we change this kind of thinking? Is this a shortfall of the system? Doctor, we spoke about systems side of it, right? What the government is doing, different organizations are doing, what the healthcare framework is. I'm assuming equally important is the role that is played by the bystander, right? There's people like us, right? And Section 134A of the Motor Vehicles Amendment Act does provide an insulation from any legal or procedural hassle, to the bystander who or the passerby who steps up to help, the road crash victims and transport them to the hospital, and so that they don't have to worry about being entangled in the legal process of it all. But this Good Samaritan law, has this really helped, in trauma care from your vantage point?
So Karthik, surely it has. I mean, in one line, if you want to an answer, and then I'll go into depth of it, is that surely it will help. It has started showing in the trauma centers, but it needs to be, sort of the masses need to be educated in that. They're still not that much educated. And through your program, I would like to once again reiterate that this is one of the most significant laws which has come into force just about 2 years back, 2 to 3 years back. So it will take time for it to sink into the general masses. But what I can say is that till about a decade back or even 5 years back, people used to get scared. People never used to bring victims of roadside accidents to the hospital. And partly it was our fault as healthcare providers, as hospitals, and partly our laws were such that anybody who would have brought these patients would be eyed with sort of a suspicion that probably he's the one who's caused the crash. And the police gets involved because it's a medical legal case. Any road traffic injury or road side accident is a medical legal issue because of many reasons, So police comes into the picture. Most of the hospitals would have a jockey or a police post within the hospital. And then there was also a sort of a thing that unless the police intervenes, we'll not start the treatment. That was probably misfounded, because since the time I am there for about 3 decades in this profession, we've never waited for the police to come or a case to be made. In government setup, at least, we used to start the treatment, send a report to the police, and then the police used to do whatever they used to. But the person who had brought the victim was definitely asked for his address, his name, his identification. And later on, when the case was being solved or tried to be investigated by the police, obviously they had to be called multiple times, and it was a hassle for them. One, they did a good thing by bringing the victim, but they were they thought that they were being victimized. So this law has at least put it to rest that if you bring an accident victim to the hospital, you need not. So it's upon your will. If I want to tell my name and my phone number or my particulars, I could and help the police in solving the case. If I do not, even if I have caused the injury, I would not be asked anything. So, as per the statistics in our trauma center, previously, I think in about 6 months or a half a year, or in about a year, hardly we could get 15 to 20 such people bringing in patients, one every month or one every 15 days. But now, I must say that we, at least in a month, around 15 to 20 such people. But also attached to it, Karthik, is the other fact that as bystanders or laypersons, we should also know some basics as to how to transport them so that we don't sort of cause more injuries. Yeah.
But we're talking about one legal, one law in this case, Doctor. What about some of the other laws and policies which are directly or indirectly related to road crash victims? And are there any rules you believe would help better to strengthen our current services?
So if you see the legal framework of road safety for that matter, I think 4 or 5 laws which are already there in the country need to be enforced more. For example, helmet law. Right, it's a very basic law that everybody riding a two-wheeler, motorized two-wheeler, has to wear a helmet. It's got nothing to do with anybody else, but your own safety. Right? If you don't wear a helmet, there are more chances of severe head injuries, and you're dying, whether on the spot or within the hospital. And if you get a head injury, mind it, then the chances of your going back to the society are even less. So you would be disabled, or you would have certain defects, deficiencies, because our brain controls our body, our mind controls the whole system. So you might forget, you might do things not, and many of them would become vegetative in the sense that they are just existing. They cannot do anything on their own. They're non-ambulatory. They need support for their feeding. They need support for their everything. So I think uh, helmet law is one of the major laws which needs proper enforcement. The other one being the seat belts. Seat belts and other things which are four-wheeler driven are still yet to catch up in the terms of numbers or number of victims in India, because still majority of the patients who are coming in are motorized two-wheelers and not four-wheelers. The other thing which is 100% preventable is drunken driving. And I think we should all realize it, that if you are drinking and driving both, you're not only having a problem with yourself, you might injure yourself, but we all know that drunken driving, people can injure others, on the road. And that's what I meant when I said that it might not be your fault being on the road, but somebody else's fault, and you are a victim to it. Then the speed laws, right? We all know that there are signs on the highways, on the arterial roads within the city, which say that you need to drive at a certain speed. Now, why are they? It's not that somebody wants a challan out of you if you go above those speeds. It is because that road is made, or that road will be safe if you drive within those limits, right? So if it is 50 in Delhi, we know why it is 50 in Delhi, because there are many intersections which are cutting through the arterial roads, and you might have to brake very frequently on these roads, even in the nights. And it takes certain time for a car or for a two-wheeler to stop completely. So that's why it is 50. That's why it is 40. It's not just enforcement or trying to take challans or money out of you. So the road is built for that particular speed. Similarly, expressways, it's 80 or 100. So speeding is the other law, and which is not enacted till now. And I would say that through your program, I would like to tell is the use of mobile devices while driving, or even walking for that matter. I see every day so many youngsters with their headphones listening to music, or probably talking on the phone while even walking on the pedestrian way. And it's very easy to be cut off from your surroundings when something is playing in your head. And you really don't come to realize that you're on the road now, not on the pedestrian way, or you're crossing a road and some vehicle is coming at X speed and you are not able to judge. So I think mobile usage or distracting behaviors are the other one. We need to enact them. So the laws are there for example, I'll tell you, helmet law is there in India, seatbelt law is there, speeding law is there, drunken driving law is there. We need more enforcement. And I would say the policies and laws are something else. We need more public education. It is for them. They need to understand that the enforcement, so it's not always stick. So we need to make them realize that this carrot is for your own lives and the lives of your loved ones. You might be on the road, your loved one might be on the road someday and fall victim to this really unnecessary event.
To sum it all up, Doctor, we're at the end of the conversation. What are some of the things that you would strictly recommend road users to refrain from?
Okay. So I think I would again, request all the youngsters, all the people who are there to find out, and there are many agencies which are conducting these first aid courses or emergency care courses. Find out which is the agency, which is the hospital which is conducting. Please go ahead and train yourself, because someday you might probably save your own loved one who's traveling with you, or loved one on the road. Some basic life skills like CPR, like how to carry the trauma victim, how to stop bleeding. Take care that the trauma victim is not handled in a way in which the whole spine moves around. And very often we have seen that from the injury side, people pulling the arms and the legs and making a sort of boat out of it and shifting them. No, that's not the right way. Secondly is control of external hemorrhage. So at least, you should know that whatever you have in your hand, maybe a cloth, a handkerchief, a chunni or whatever, a stroll, just tie it tightly from wherever he's bleeding, right? And then later on, we teach about splinting or using sticks and all to stabilize the fractures. That's something which we practically teach people. And you must also know basics of CPR or compression. So I think everybody needs to go through that drill. It should be taught in schools, in fact. And we've started a program from AIIMS wherein we now are teaching Delhi school teachers, the physical education teachers in basic life skills, the ones we told, and they would then teach their students.
Dr. Gupta, thank you so much for your extremely precious time. This has been extraordinarily insightful and eye-opening. I can't thank you enough for what you've shared on the show. Thank you.
Thank you, Karthik. Thank you so much. It's lovely to be on your show, and also that probably I just feel that if this goes viral, then probably many more lives can be saved. Just if you just bring a trauma victim in time to the hospital, I think that's more important. Be a good Samaritan.
Absolutely. Thank you. That brings us to the end of today's episode of Milestones, the Save Life podcast. My name is Karthik Nagarajan. If you have been tuning in and feel that road safety deserves way more attention than it gets, please do consider sharing this episode with your family and friends. Do also review us on whichever podcast apps you listen to us on. If you're watching this on YouTube, do leave a comment to let us know what you would like to see us cover next. For more on all things road safety, please visit SaveLIFE Foundation's website. It's www.savelifefoundation.org or any of its social media pages on Facebook, Twitter, and Instagram. We'll see you again next week. Bye.
AIIMS